I want to turn our attention south of the border, where the number of COVID-19 cases now tops 2 million. That's more than double the cases in any other country. More than 21 states are also seeing surges in cases and hospitalizations this month after reopening their economies. Are there lessons to be learned here for Canada? How can this country prevent the same spikes? Dr. Zain Chagla is the medical director of infection control at St. Joseph's Healthcare in Hamilton. He joins us from Mississauga. Dr. Isaac Bogoch is an infectious disease physician and clinician investigator at the Toronto General Hospital Research Institute, and he's with us from Toronto. Hi to both of you. Thank you so much for making time for us.
Thanks for having me.
So I really wanted to pick your brains today because I have been reading a lot about the spikes south of the border, and I have to say, living in a province where we're about to reopen the economy, it makes me nervous to see that. And Dr. Chagla, I'll start with you. There's 14 states really that are seeing, big spikes. It's not, they are notable spikes after reopening their economies. What do you take from that?
Yeah, I mean, I think that there's a number of issues here, and certainly the numbers are pretty staggering. Arizona, which is one of the hardest hit states, had 1,400 cases for a state that's a third the size of Ontario, where we reported 200 cases today. Many of the issues may have been with when they opened up. So although they may have flattened the curve, they may not have seen that sustained drop in community transmission. And as the economy then opened up, you still have these seeds of community transmission ongoing. It's not unexpected that you start seeing a rise in cases in their community, and it just happened relatively quickly.
Dr. Bogoch, what do you take from what we're seeing south of the border right now?
I mean, I think the take-home point for me here is we shouldn't open our border. I mean, we've got to be very, very careful with the Canadian border. And I appreciate that, some parts of Canada have done a great job. And, we've been a little bit slower in other parts of Canada getting this infection under control. But across the board, we're actually doing really well, even in our hardest hit places. And we can undo a lot of that good work if we open our border and allow for the importation of cases. And as Dr. Chagla just pointed out, I mean, it's staggering to see some of these states with, tremendous increases in COVID-19 cases. They're actually having limited hospital and ICU capacity now. Things are not getting better. And we sadly need to protect ourselves because it's really going to be out of control there for a little while. And it's going to take a lot of efforts for them to rein that back in.
Dr. Chagla, is there a lesson for us in the speed at which things reopened in those states as well?
I think it's simply that we've made the decision to reopen when our community case counts are relatively low. And I think that's an important point. People had to wait it out for a bit longer in Ontario and the rest of the country. But that's the important part. If you open up too early, if there's still a lot of community transmission ongoing in your communities, even though the numbers look better, you're going to see this flame start right away. And that's what we're seeing in the States. So I think the lesson was learned early. And I think our politicians and our health ministries took into advisement aiming for lower numbers before the restart. So I think we're starting on better ground than the United States for sure.
Dr. Bogoch, do you think we're starting on better ground? And a warning, I'm going to have to interrupt you in 30 seconds to welcome some viewers to our show.
There's no problem. I'll start and then interrupt and then I'll continue. But
perfect.
Yeah, I think we're doing okay. I think we're doing okay. And I think the key thing, as Dr. Chagla points out, you got to do it at the right time. But in addition, you also have to have the right tools when you do it. So when you do start to open up, remember, this is a gradual opening up. It's not a free-for-all, at least it shouldn't be, although it appears to be that way in some of the states. As you open up, you should have the capacity for the rapid detection of cases, the ability to diagnose people, the ability to conduct contact tracing quickly, the ability and capacity to support people through a 14-day period of isolation who are infected and they're close.
I'm going to interrupt you. Sorry, Dr. Bogoch. My apologies. I am Vashi Kapelos, and this is Power and Politics on CBC News Network. A warm welcome to viewers joining us on their local stations in Ontario and Quebec. We are talking about the spread of COVID-19, both south of the border and in this country, with Dr. Zain Chagla and Dr. Isaac Bogoch, who I just rudely cut off in the middle of his very important point. Dr. Bogoch, continue. My apologies. Thank you.
No, it's no problem at all. But, as we were just chatting about 25 seconds ago, I think the key point is when you do open up, you've got to have the right tools for success. And that means you have the ability to rapidly detect cases, the ability to enable people to get diagnostic tests and have a rapid turnaround time of those diagnostic tests, the ability to follow up on that with contact tracing in a meaningful time frame, and the ability to support people who are infected and their close contacts through a period of isolation. So with opening up at the right time and those issues looked after, you can likely do so on a safe basis. But even with everything looked after, you're still going to see cases. This is a very patchy infection, and it would come to no one's surprise if there's small outbreaks. It's, can you quell those quickly before they burn out of control?
And specifically, Dr. Chagla, in Ontario's case, I was hoping to drill down because we're going to enter that process now where things start to reopen, cases pop up, and we have been following very closely, for example, the testing numbers, which seem to have improved a lot this week, the testing capacity and also whether that capacity is being fulfilled. But on contact tracing, there seems to be a bit of disparity, in the GTA versus other areas. I know the goal is, I think, that you contact that person and close contacts within 24 hours, 90% of the time. I think that's happening in a lot of places, according to a report I read in the Globe. But in Toronto, I think they're only at the 80% mark, something like that. How big of a deal is contact tracing going to be?
I mean, I'll use the example in South Korea where they opened up very quickly and saw a large outbreak. Their contact tracing was essential in this process. They identified transmissions within the nightclubs downtown, and essentially once they shut them down, sanitized them, they were able to quell things at an outbreak of 200 to 300 cases. And so, yes, the speed of contact tracing is important, making sure that those cases and their contacts are notified very quickly. But it's also that part of contact tracing to know what environments are people going in? Where are we seeing these local outbreaks, like within the migrant farms within Ontario currently? And how do we respond to those, not only in the timely manner to deal with the outbreak at hand, but to prevent future outbreaks down that line? So that the contact tracing really is not only at the individual and the cluster level, but also at the systemic level moving forward in terms of how to reduce the risk in those industries and prevent those outbreaks going forward. And
what's your sense, Dr. Bogoch, of the province's handle on exactly what Dr. Chagla just laid out?
I think it's a bit heterogeneous. Some places are able to do this faster than others. And in fact, we're finding one of the roadblocks is in the laboratory, and there might be delayed contact tracing because of laboratory turnaround time. You can't do contact tracing if you don't know who to contact. And contact tracing has to be done as soon as possible after there's a positive case. So, there are systems level issues in some places that hopefully are being ironed out quickly. But in general, I really think we're actually doing okay in Ontario. Yes, it's been slower than we would have liked, but in general, I actually think we're doing okay. And there are, tremendous efforts to iron out some of the wrinkles that we have, namely the turnaround time of tests, the rapidity of contact tracing. And I think the next thing, as Dr. Chagla pointed out, is really focusing on high-risk communities that we weren't really paying attention to before. So we know about the long-term care facilities, but of course, now we're looking at other communities like migrant workers and congregate settings.
Yeah. Dr. Chagla, last question to you, and that is one that I think I keep getting from people who are, get inundated with information and therefore, and I'm one of them, probably confused a bit by what we're going to expect, especially here in Ontario tomorrow. Other provinces have already experienced it. When the doors open and the patios open and the hair salons open, what is your best advice for people about their own behavior?
Yeah, I mean, I've been asked this a number of times. And the way we've been living for the last few weeks, there's a little bit more freedom going into society, but it doesn't mean that you have to ignore the principles of the last few weeks. So you shouldn't be entering back, doing those activities if you're feeling unwell. You should be focusing on your hand hygiene. It's not, even though there's gathering of 10, it's not an excuse to be in close contact and close proximity with those 10 people, especially out of your bubble, for a significant amount of time. And so it's not an excuse to go out and go back to normal. There are some liberties that are being granted, but again, physical distancing, wearing a mask when you can't space, washing your hands appropriately, not going out when ill, those are still principles that will have to be applied not only for this month going forward, for the next phase going forward, but essentially until this thing comes under control or we're able to deal with it more. This is going to be the new normal.
The new normal, that's what we call it, right? For sure. Thank you very much, both of you. I appreciate your time and expertise as always.
Have a good evening.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.